This is not meant to be a standalone procedure. So there's no real aftercare for this, which is nice. And you can combine this with lasers, other fillers. You can obviously do it with Botox, doing something like injectables, then pair it with something that's a procedure, because if you do a laser or BBL light treatment, it is going to make your injectables look better, Botox fillers, etc. So you've got to take care of your skin in addition to lifting and such that you might do with fillers. And I know I'm saying fillers, this is really not acting as a filler here. This is acting as a collagen stimulator today because we have diluted it. The other, oh, I forgot to talk about the fact that the other place you can put hyperdilute Radiesse is your booty. So it's typically 10 syringes per side, but it can last you a couple years, and it's not a Brazilian butt lift, but it helps to restore a natural, athletic looking butt. So we love the booty lift with Radiesse. And now we're combining that booty lift with Agnes for even more booty lift. So that is your typical hyperdilute Radiesse for collagen stimulation of the lower face. And then I would tell her, come back in a couple months and we should do it one syringe and split it between the sides again at that point. So she'll be a little bit swollen today. That'll go away in another 1 or 2 days. She might have a bruise at this spot, but I don't think so since she's not bleeding there. She will be numb for the next couple hours, but just because of lidocaine, but that'll resolve too. And basically, you don't really need to do anything for it. So if you want to find out more about hyperdilute Radiesse or about any of the procedures we do at RejuvenationMD, you can find us on Facebook, Instagram, YouTube, and on our website at RejuvenationMD, medspa.com.